here all evening. That's all right. We're recording. Thank you, Carl. So good evening. I'd like to call to order the Wednesday, November 18th, 2020 Garrison Board of Education regular meeting. We will begin with a roll call. Dusty, will you call the roll, please?
Jocelyn Apicello.
Here.
David Gelber.
Here.
James Hoke.
Here.
Madeline Julian.
Here.
Courtney McCarthy.
Here.
Matthew Spicer.
Here.
Sarah Tormey.
Here. Thank you, Dusty.
Thank
I
you.
will now lead us in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all. Thank you. We now move on to accept agenda and agenda changes. Does anyone have any proposed changes? Okay, I'm going to read the recommended action. Be it resolved that the Board of Education of the Garrison Union Free School District hereby accepts the agenda as presented. May I have a motion, please?
So moved. Seconded.
Thank you. Dusty, will you call the roll, please?
Jocelyn Apicello.
Aye.
David Gelber.
Aye.
James Hoke.
Aye.
Madeline Julian.
Aye.
Courtney McCarthy.
Aye.
Matthew Spicer.
Aye.
Sarah Tormey.
Aye. Thank you. And now move on to President's remarks. Tonight, I'm going to begin with some sad news. Maureen Sheehan, a longtime member of the Guffs family, passed away on Monday. Sheehan served as a substitute teacher and tutor to many of our students. Our thoughts are with her family, and on behalf of the entire board, we are so very sorry for your loss and for our community's loss. Since we last met as a board, our school community experienced our first COVID case. And I just saw before I entered the meeting that as a nation, we have surpassed 250,000 COVID deaths as a country. Very sad news, of course. But looking at our community, I would like to extend the board's well wishes to the infected individual and their family. The health and safety of our students, staff, and teachers remains at the forefront of our minds. I would also like to commend our administrative team and, of course, Nurse Melissa and our school counselor, Krista DiDiego, for how they handled the situation. Our team worked closely with the Department of Health to determine which students and staff needed to quarantine. Instead of waiting for the state contact tracers to make calls, they reached out to all of the impacted community members determined to be close contacts by the Department of Health, and they undertook this task on their day off. So I really wish to thank them for doing this. Tonight, we're going to look at how we move forward. I believe I speak for the full board and our administrative team when I say that our primary goal is to provide the best education to our students while also facing the realities of our current pandemic. There's a lot of challenges here. We will have a time for public comment at the end. I ask that members of the public remember that comments or questions about specific school personnel or individual students is a violation of our policy. And at the end of the meeting, if members of our community have questions, please reach out to our administrators. I know there are a lot of rumors out there, but please contact Carl, contact Allison, reach out to Nurse Melissa or Krista DiDiego if you have questions. I know this is a very challenging time. It can impact our students' mental health, both our elementary students, our high school students. If you need support, please reach out. If you have questions, reach out. We're here for our entire community, and we really want to be as much of assistance as we can during this difficult time. And on that note, I'm going to hand it off to Carl for superintendent's remarks. Thank you.
Thank you, Sarah. I'd like to begin with just a business-related item. As your superintendent, I've been reviewing numerous district plans and policies, as all of you know. And in doing so, I came across an issue with our district's health insurance plan. Under the plan maintained by the district's health consortium, employees whose spouses earn above a certain monetary threshold are required to contribute additional amounts towards spousal coverage. Apparently, a former business employee mistakenly informed employees that they were not required to pay this amount. I don't know why this information was provided, but I do not see any wrongdoing on the part of our employees. Given the fact that this was an error of a district employee that caused the non-payment and the difficulties that would be met in recouping the monies, it is my recommendation to the board that we do not seek reimbursement from the employees and that we look to the 21-22 school year to address the plan and this provision specifically. So we'll take a closer look at it next year. That is my recommendation to you as a board.
Carl, if I may, after consulting with council, the board would like to accept your recommendation, and we really appreciate your diligence in reviewing our district's plans and policies. Thank you. Okay, back to you for more updates.
Okay. Now, probably the topic that our board and our audience is most interested in is school closures. Sarah, thank you for summarizing. I think you did a great job of outlining the steps we took with the one infection and how it was handled. I just want to basically recognize the Putnam County Department of Health. When Nurse Melissa, Allison Amig, and myself, when we reached out to them on Veterans Day in the morning, they immediately pulled their team together to coordinate with us and go step by step through a very tedious process, which is the first step in contact tracing, to go back and minute by minute find out who that individual had contact with over a 48-hour period. So it was a pleasure working with them. I'm very impressed with how efficient they were and their hard work. So kudos to them. Back to the district's decision to close, I think it is something that probably requires a bit more explanation to you as a board and our community as well. I did my best to summarize it in my last communication, which was sent out over the weekend. But the rationale behind the decision to close prior to moving into what New York State is referring to as a yellow zone designation, basically, there were two parts to this decision, or two things that really influenced my thinking. The first is this new metrics that we are using. It's a microcluster strategy that was rolled out by New York State several weeks back. And it is going to require all school districts at some point, if the infection rate keeps going up, it will require us to close at some point unless we could implement a testing program. I know there's a lot of talk out there and a lot of curiosity around a testing program. In a few moments, I'm going to invite our school nurse to speak to that in more detail. But basically, I'll start by saying we just simply are not ready to implement the testing program. Garrison is not alone. This is really every school district in the region. I meet twice a week with superintendents groups. One is a regional group that includes 4 different counties of superintendents. Departments of Health have been joining us pretty regularly there. And then I also meet with just the Putnam County superintendents as well as the Putnam County Department of Health. So we have been meeting weekly. And I will tell you right now, no one is ready to test, but we are all hopeful that at some point in the near future, we will be able to. At this point, I'm going to ask Dusty to help me by just sharing her screen. And I want to give you the latest update on the infection rate. So this information is public information. I just put it in a format that I think would be easy to read. But basically, you have 8 days of the 7-day rolling average for Putnam County's infection rate. I went back to November 10th because that is the first day that the 7-day rolling average was above the threshold of 3.5%. If you remain above 3.5% for 10 days in a row, you hit the yellow precautionary zone. And just to describe that a little bit more, in the yellow precautionary zone, basically you have to close unless you can immediately start a testing program. And then you're required to test 20% of your students as well as 20% of your staff members. And again, as I said earlier, we are simply not ready, like almost all districts. And we hope at some point to be ready. But as you can see, based on the trend line, within a few days, we will hit that 10-day mark. And I do believe by this Thursday, we will be in the yellow precautionary zone. I think statistically, there's no way around that. Now, what's more concerning for me is if you move to November 13th, you see a 4.7 7-day rolling average positivity rate. That is above the threshold to move into the orange zone. So 1 percentage point higher, instead of 3.5, now you have to be above 4.5. And if you look, we have 5 consecutive days where we are above 4.5. If that continues for 5 more days, which would be Sunday evening at the end of the day, then we will move into the orange zone. And in the orange zone, basically you are required to close. You must close for 4 days. After that, you do have an opportunity to reopen. However, you need to test 100% of your students and 100% of your staff before they could return. Then once everyone tests negative, you can't return unless you test negative, then you must maintain every week 25% of your staff and students being tested. Now, again, that is a very challenging task. We are just not there, even with the tests themselves. New York State has promised to deliver tests through the local Department of Health. In Putnam County, we have put in a request. All the Putnam County superintendents have requested the test, but we simply don't have them here yet. And then after they arrive, then we have to train our personnel, and in our case, it would be Melissa DeFonts, our school nurse. We'd have to train to administer the test, and then after administering the test, you have to be you're responsible for reporting data to New York State. Dusty, you can stop sharing the screen at this point.
Carl?
Sure, I'll take any questions, David.
I have 2 questions. One is that percentage is a percentage of all the people tested on any given day within Putnam County. Is that what the denominator is on that?
Yes, what they do is they take the total number of people tested, and then of course, how many positives, and that gives you the daily percentage, David. But what I was showing, just to be clear, that's the 7-day rolling average. So
Right.
In recent days, the daily rate was actually a bit higher. It's pulling up that 7-day rolling average.
And more importantly, give us a sense of what it would take for the testing material, testing protocols to become available to our school.
Well, I think I could give you a good answer, but the person who could give you a better answer is Nurse Melissa. And she was kind enough to join us this evening. So if you don't mind, I'll promote her, and Melissa can speak to the testing program. Just give me a moment, please. Good evening, Melissa.
Good evening.
Hi, Melissa. Thank you so much for joining us, and it's an honor to have you with us here this evening. Melissa has been a true hero, and I don't say that lightly, and I mean that, Melissa, throughout this entire school year, and we're very fortunate to have her. But Melissa, our board would like to know a little bit more about the testing program, if you wouldn't mind explaining some more detail.
Thank you. Yes. So, Mr. Gelber, you bring up 2 wonderful points. I want to first speak to the point that was already answered. It was a really good question. This number, this percentage rate that is today 5.3, is positive for people tested. That does not account for the people who have not been tested, who possibly are positive within our community. So I don't want to frighten anyone. I just want to make you aware that 5.3% is pretty high. The number is probably higher. Secondly, to speak to your question about materials, the New York State has been kind enough to offer us materials, testing materials, and the testing machine for zero cost. The problem is they cannot release those supplies to us until we enter a yellow or an orange or a red zone. So until we hit that threshold, there then becomes a time where we do not have the supplies. I can actually not even receive the testing for the kits that they will provide to us until we reach the yellow zone, because there are different kits and different machines. So they actually wait to test to whatever kit and machine Garrison will receive. So then I join a course sponsored by New York State, and I'm taught how to take the tests and also how to process the tests and enter them into the system. So I'm able and willing. There is a bit of a lag there because it will take time to physically get the tests, for me to take the course to administer the tests, and for us to begin testing. Does that answer your question?
It does, and thank you very much. Got it.
Of course, of course. So I am very aware that testing is very much on everyone's mind, and I want to say that Garrison is very willing to start this process, and I hope succeed in coming to the point where we can test. I want to remind everyone that what the precautions that we have in place and the precautions that have been handed down to us by public health officials are really important precautions. Mask wearing is key, hand washing is key, social distancing is key. This is how we have gotten this far. And I think that those are the key things that we need to focus on at this point to be able to pull back from these high percentages. Yes, go ahead.
Melissa, a question for you. Would parents and staff members be able to bring in a negative test from an outside source, or does the test need to be administered through you and the program provided by New York State at our school?
That's a wonderful question. Parents can bring in a negative test from a physician, yes. If we were in a yellow zone and we were proceeding with the testing, that is a possibility. There are certain restrictions on what the time frame is for the testing. It has to be within 7 days, and it has to be a maximum of 20% of the population. So another concern is that doctor's office and urgent cares are getting overwhelmed with requests to test at this point. So I know someone who was trying to get a test who actually had to make an appointment for 10 days from now. And that's a scary reality, because the testing is really what we're relying on to get people to where we want them to be. But the testing is not as available as it was a month ago. Hopefully that will ramp up as New York State releases more kits, but for right now, it's not as available as it has been.
And one more question, as I know we have a resolution later on our agenda regarding testing. Has the Department of Health, and I know this is continuing to change, I mean, since the resolution was crafted to now, it seems every day this is changing. Have they indicated a plan for rolling out the testing once we hit the yellow zone? Is there a structure in place? Do all districts get it at the same time? Is there a priority list? Do we have any?
Not that I'm aware of. The Department of Health has been wonderful and willing to help us in any way they can. And I think they want to make this happen in a seamless way. But because we're not in the yellow zone yet, they can't roll out specific plans. And maybe there are plans that we just haven't been informed of. But for right now, I don't have a specific plan as to how they would get us the product, how they would, I do know how they would train us, but I don't know the specifics of the steps. That hasn't been released to us yet.
Thank you. Any other board members while we have Melissa with us? I know we'll be continuing to talk about this during the meeting. If you have other questions that you would like to ask, please. Okay. I don't see any at this time.
And Sarah, if you don't mind, with Melissa here on the panel, if I could just continue and talk about one other aspect of this, which really all districts are facing, and that is the staffing challenge. So this was not included in my written communication to the community, but after we learned that we had one individual in our school who tested positive, and after all the contact tracing took place, there were 12 staff members that needed to be quarantined. There were also 37 students that needed to be quarantined. And that number of 12 staff members presented a significant challenge to the district. Larger district, the number 12, 12 employees maybe is not significant, but in Garrison, when you have roughly 50 employees total, you're talking about 20% of our staff. And everyone is needed. The plan we have in place, as Melissa said earlier, masks, social distancing, those basic things that we're, basically asking everyone to follow, and we have been following. Those are more important now than ever. And without those 12 staff members, we were really stretched this past Monday and Tuesday. It was difficult. Teachers gave up prep periods. They gave up lunch periods. It was all hands on deck. Our principal was covering classes. And I thank all of them sincerely, because everyone pulled together to get through 2 days. The motivation to get through 2 more days was to have a more smooth transition for students, for staff, and for families. What I learned from a lot of the other districts, and we all share as we have infections, when we have situations, we share so we can learn from one another. And what everyone is really struggling with is, if you have an infection and you have to have an abrupt closure, it really takes its toll on the students emotionally, on families, on staff. It's a very difficult thing. And some districts have been open, then close, then open and close. And it's this constant back and forth. And what we try to accomplish with proactively, announcing a closure 3 days in advance, was to give people time to prepare, materials. For example, our teachers had a huge distribution that went really well. I think everything was finally given to families this evening, but also to mentally prepare. We thought that was important. So there could be some closure. The hope is to get back Monday, November 30th. So the 12 employees, their quarantine will be over by Thanksgiving. And right now, I'm going to remain optimistic, but we also have to at the same time be realistic and watch these infection rates. I mean, the data is there. If it doesn't turn around within a day or so, then I think it's almost certain that we will end up in the orange zone. If it keeps increasing day by day, and think of it this way too, and Melissa, please feel free to add to this, but the infection rates that are being published over the next few days, whatever interaction you had that caused you to be infected, it already occurred 3 or 4 days ago. So you're usually asymptomatic for several days. Then when you have symptoms, that's usually when you go for a test. Some people test proactively, but that's important to remember. Basically, the die has been cast already, and I think whichever way these numbers are going to move, that's what we'll have to address. And I think in 2 or 3 days it'll be clear to us. And if we hit that orange zone Sunday evening, we won't have the data till Monday, by the way, but then we will do an update to the entire community. I'm hopeful that it'll decrease. That has happened in some places. So, I mean, that's not totally out of the realm of possibility, but I think it's more likely that the infection rate will go up. And at that point, we will have to remain remote until we could test. And just know that Melissa, myself, the Department of Health, we will continue to work together, and we'll give you continual updates on our progress with testing. And Melissa, please, is there anything that I missed that you think is important to add?
I would also like to say that I think this community has done a fantastic job with education, with buying your kids 1,000 masks to find the right one that works, with hand washing. These are all things that if we double down on as a community, we can bring the rate down. We can do this as a community. So I would just say this is the time to, stay with your immediate family, to really wash your hands a lot, to be good mask wearers, to do all those things, just to work together to try and bring those numbers down. Thank you.
Thank you both to Nurse Melissa and Carl. Carl, do you have further updates for us, or should we move on?
That's all. We have our principal and our new director of technology who would like to speak a bit more about the remote learning model.
Before we get to that, I do have one question. In terms of our high school districts, I know both are in a little bit different situation right now. Do you have a brief update on where they are?
I do. I just received communication just recently, so I don't even know that this is public yet, but Frank Sheboy over at O'Neill is continuing the remote model. There will be no in-person from now through Thanksgiving. And again, I think like us, I think they are hopeful to be back after Thanksgiving, but I know they've had a number of positive cases that have one after the other forced them to remain remote. So that communication, if it didn't go out, will go out shortly. And I do believe Haldane, fortunately, has not had a case as far as I know. So they will continue with their hybrid model as long as possible.
Thank you. Okay.
Thank you, Melissa.
Okay, so should we move on to principal's remarks? Do you want to bring Allison up, Carl?
Sure, just give me a quick second.
Yeah, of course. And while you're doing that, I will say thank you to Nurse Melissa again for keeping our school open as long as it was. I think a lot of that was due to really closely following those guidelines and the attention that went into putting together that plan with the social distancing, the mask wearing, and the hand washing. So I'm glad it worked for as long as it did. Okay, welcome, Allison.
Hi.
Hello, Alice. Allison, would you like me to promote Scott and have you present together, or?
Yeah,
Okay.
I think that would be great. How is everybody tonight?
Very good. Happy to have
Good.
you here.
Good. Well, thank you for having me tonight.
I think we may have lost Courtney.
Hi, everybody.
Okay. Should I start? Or should we wait? Oh,
I
there-
don't see Courtney in the,
I see her.
I see her. There she is.
I'm back. I'm sorry. I got kicked out. I don't know what happened.
Okay. All right. Well, thank you for having me tonight. I just, have a lot to share, but I'll speak briefly, okay? Even though I'll try to get through all my talking points. But the past couple of weeks it's been a journey, and it's been an incredible experience. The community has been unbelievable, the teachers, the kids, and all of the parents and the administration. So I can't thank you guys all enough for the support that you've given me in order to kind of hit the ground running. So, last week I really worked on finalizing the action plan for remote instruction, and that was distributed to the community. It was shared with our staff. We reviewed it as a staff. They weighed in, helped to craft that plan with me. And so now you have it in your hands as a community. And, we are going to be surveying the community briefly on whether or not there are pieces of the plan that needs to be adjusted. This is a living, breathing document that, we're going to continually review and seek feedback for improvement in the plan. So that's something that went out. We also made a lot of, I think, wonderful progress in our professional development plan last week and this week. And Scott's going to speak more specifically about that. But it began with a needs assessment from, for our staff, and collecting what the needs are and then crafting a very specific plan for them. And so, all of those PDs were in motion last week, and they will continue. And Scott will speak on behalf of that after I get through my points. One of the things that we also had to do was to get all of our materials coordinated so that this way the kids had everything they needed that is tangible and sent home. So the kids played an enormous part in that. We had activated the facilities department with getting the boxes that are necessary and needed. The kids all, helped to create those boxes and what was needed, and the teachers. And then we put out that message to the community to come at a designated time to pick up their materials so that we could hit the ground running when we do transition to remote, which was today was our first day. So that was just an enormous coordinated effort on that engaged everybody, and it went, I think, relatively smooth. Another thing that we did and that we accomplished, and we still want to, keep it going, is our ongoing communication with families. We started with our iTutor families on Monday, and one of my commitments is to maintain and continue to build a connected learning environment, especially when we're going to be now so disconnected in person. So, we have a lot of our iTutor students who are now going to join us in our remote plan at Garrison. And so we did provide the families with 3 different options. So the one option is they could choose to stay with iTutor and not disrupt their current learning plan, or they could choose to come to our remote plan at Garrison and then just dive right in and join us. Or they can kind of have, one foot in both. They could continue with their 4 core content areas in iTutor and then cross-reference their current schedule with iTutor to our schedule and find opportunities to join the Garrison students in their remote experience. So, I already had some parents have their child join for specials or for a morning meeting. So these are important opportunities for the kids to bridge. We're going to bridge those 2 communities so they have an opportunity for engagement with each other. So let me see. We also, I just want to refer to my notes. I don't want to miss anything. I think those were like the big things that we worked on. And, I want to pass it over to Scott because I know that he's got a lot that he wants to say too. So Scott, you want to fill in some of those gaps with PD?
Sure. First off, thank you for having me here tonight. I'm going to cover what I have been focused on. So I was appointed on the 4th. And on the 5th, I said, all right, we're going to be laser focused on preparing for a remote platform for education. So on the 5th and 6th was really auditing our current practices, surveying the resources, speaking to teachers, and seeing what kind of tools we were using currently and what the comfort level and readiness was. So on the 9th and 10th, we started back-to-back professional developments that was really geared off of a survey that we gave to the staff. So it was voluntary. It was pretty much professional development menu all day long in the G Suite tools. So Google Docs and Google Forms and all the things that the district currently uses. On the 10th, we had, on the 11th, we found out that we had a positive case, and we made that determination that we were going to focus all of our efforts on setting up the Google Classroom and things that specifically were going to be used for the remote platform. So on the 12th and 13th, it was very targeted professional developments for teachers in Google Classroom. And we worked with the service providers, and we really built a skeletal system of how this can look going full remote in a very, very short amount of time. And I have to give credit to the teachers and the administration, because I've never seen a group of people pull together more quickly and share ideas, and with just grace and professionalism that is just unparalleled. So on the 13th, which was last Friday, we streamlined the systems. We knew that we were probably going to enter into some form of remote platform, and we knew we needed to get technology in the hands of community members that needed it. So we built a system to make sure that parents had access to the school resources. So I worked with Miss Emig and Mr. Albano, and we put together this really comprehensive system where parents would come and pick up devices, and we'd have the sign out of the devices. And that was done over the last 2 days. So it's been real laser focus on making sure that we got that in order. Then came the stress test today. So today was the first day of remote. And I have to say that it was very satisfying to see all of the systems that this team, that the teachers have worked with me and have worked with this administration. It worked, and it was really cool to see it all happen. And we're only going to get better at it. And so that has been really my focus now, to speak about what the future will be. I'm going to still hold remote PD for professional tools that we're going to use that are all EdLaw 2D compliant. So we're compiling a list of all the tools that are EdLaw 2D compliant, which is really around data and student privacy. I'm going to work with Miss Emig and Mr. Albano to create a feedback mechanism, not only for the staff, but also the parents, because they're the two entities that we need to make sure are comfortable in this whole transition. So we're working to develop that feedback mechanism. We're going to organize the one major area that I think that we should be focusing on as well is the website, the landing page for all parents. I think we need to make sure that it's user friendly and it has all the relevant information, and it really becomes the go-to place for accurate information. And I think that without a really good landing page like our school website, that's when rumors begin to fly and misinformation circulates. So we just want to have the most accurate, up-to-date information on a very aesthetically pleasing landing page. So that's going to be my focus in the coming weeks, along with very targeted professional development for the teachers and that feedback mechanism. And I can answer any questions if you have any.
Yeah, board members, if you have questions for Allison or Scott, please let me know. I think you both have done a tremendous job in the short time you've been with us, and I want to thank you for your efforts on all of these fronts. I know the transition to remote is certainly not ideal, but seems to have gone very smoothly, and I appreciate that. Any questions? Madeline, please.
Thank you so much for all the work that the entire team has put in, and definitely on the technology side, we can see the difference on our side as a parent, right? And from spring and now, and we look forward to seeing how it keeps improving. So with the PD for the staff, that seems to really have worked. Is there resources for the parents? I know you spoke about feedback, but PD for the parents, just whatever stress we can take away. I myself, I work from home and I just check in on the kids, and whatever you can provide to us as parents, it will go a long way.
Yeah, absolutely. I agree. And Ms. Emig and I have been talking about how we're going to make sure, similarly to how we did the staff professional development, I think it starts by assessing what the needs are of the parents, and really we want to make sure that all professional development is meaningful and targeted. So by surveying parents and spending that time hearing what their stressors are, will give us clear indicators of where we need to spend most of our time. So so that's really going to be the strategy for working with the parents. And I agree with you. I think we need to now more than ever bridge that gap between school and home, because school is home. So I think that we have to really be lockstep with each other. And I think that's going to play into, I know Miss Emig is developing a comprehensive plan to meet with parents, and I could let her speak about that.
I absolutely agree. One of my main concerns at this point with kids and with our families is just ensuring that everybody is able to handle this emotionally. And we cannot forget that piece. It is critical right now for the emotional stressors are honored, and that, you know, we offer grace to people during these tough times, that we pull together, we support each other as a community. There are going to be tough days. There are going to be bumps in the road. This isn't going to be perfect. But we are all here to make this the best possible experience for the kids, for our students, and for our families, and for our teachers. They are essential workers right now. They are it. And what we're asking teachers to do is extraordinary. And what we're asking families to do is extraordinary, and these kids in the middle. Okay. So that's just my only plea to the community, and is to, you know, be continuing to be that support, that and that coach for your children, and the coach for our teachers to keep going. And that's going to be my biggest role too, is to be the biggest fan and the biggest cheerleader, so that we can get through this. That's what I have to say.
Thank you both. I really think those are great words. And I agree that we do need to offer grace to each other during this difficult time, and especially our children.
Yes.
In the
Yes.
community, not just our K-8, our high schoolers, everyone.
Yes.
So thank you for those words. Anything further for our principal and our interim director of technology, Carl? Anyone else? Okay. Thank you very much for being here, and we look forward to hearing more as we progress through this. I know it is our hope to be back on the 30th, but we are very aware of the reality of the situation we are in as well. So we appreciate all the planning you're putting into this. I'm ready, Carl?
Sure, we will be prepared both ways. Thank you, Allison. Thank you, Scott.
Thank you.
Okay, I'm going to go ahead and keep us moving. Next up, we have board communications. This is a proposed resolution on COVID-19 testing. This resolution was brought to my attention. Do I have everybody here? It looks like I still have Scott, but not Courtney.
Okay, I apologize. That is me.
That's okay.
I'll bring Courtney back right away.
I'm just going to keep talking while we do that, assuming she can hear me. So this is a resolution that was on the brought to us by Westchester Putnam School Board Associations, of which we are a member. As we've already heard about, a lot of the school districts, our goal is to provide in-person education if that is possible and safe, and we can find a way to do it. There is a lot of discussion around testing. So what I'm going to do is read the resolution for the public and for the board, and then invite discussion. We don't necessarily have to pass this resolution tonight. My goal is really to facilitate a conversation about how we can work within the larger picture of what is happening between the County Department of Health, the state's requirements, and what is possible for our little district and our students. So here we go. I apologize, it is long. whereas school buildings in New York State were permitted to reopen in fall 2020 when statewide positivity rates were well below the 5% marker set by the governor if school districts fulfilled the COVID-19 guidance of the New York State Department of Health and Education Department. And whereas New York COVID-19 community positivity rates have been climbing in November 2020, and surveillance testing is one mechanism used to track viral spread and help maintain the health and safety of our school communities. And whereas under the governor's micro cluster initiative, school-based random surveillance testing is mandated to keep school buildings open for in-person learning. And whereas public school districts have faced exceptional burdens on finances and administrative and faculty time, an effort to ensure the health, safety, and ongoing education of the young people of our state. And whereas schools and locations where community transmission rates have resulted in the designation of a microcluster zone are not set up from a financial, logistical, and regulatory perspective to take on the added burden of random surveillance testing. And whereas county departments of health are currently overwhelmed in coordinating the community-wide COVID-19 pandemic, and whereas rapid antigen tests provided by the state to some school districts have been determined by public health professionals to be insufficiently accurate to permit a negative rapid test to clear individuals to re-enter school buildings, necessitating a further round of testing that may require administration by medical personnel. And whereas school districts may desire to achieve the regulatory ability to pursue surveillance testing within their schools, either as a district or working with an outside medical partner. Now therefore be it resolved that the Board of Education of the Garrison Union Free School District calls upon New York State leaders to ensure that public school districts receive the financial, logistical, and regulatory support to undertake mandated or board-approved COVID-19 surveillance testing of students, faculty, and staff to ensure that school districts are not forced to keep school buildings closed due to a lack of resources to ensure the safety of students and adults in school buildings. And then it goes on to say that this, should we pass this, the district clerk will send a copy on to our state representatives, the governor, and the Board of Regents. Now, a lot has changed since this was initially composed late last week. It does sound like the state is trying to get us testing, should we wish it. And that hopefully they will cover the cost. I do think this brings up a great point, however, that our schools have undergone a tremendous stressor, acting as a public health center. To make them a testing center now too is a really added burden on our school and staff. So I'd like to open it up for comments or questions or thoughts from the board. Courtney?
There's been some discussion about that I've seen online, breaking up counties by zip code. I know that's not anything we can do. It's coming from the state. I'm just curious if you've heard anything about that, if anybody knows anything about that, if in the sense that we are, as we know, at the far southwestern corner of Putnam County, and here in Phillipstown and specifically Garrison, our numbers are so different from what is happening in other parts of the county. How do you see that affecting going forward?
Courtney, that's a great question, and it's being asked regularly. So I'll tell you what I know thus far. Basically, yes, Putnam County has areas that have lower infection rates, but what the County Department of Health is telling us, and they have better data. You know, we have the data that's available to the public. They can really drill down on the data, and they are saying when you look at areas, so we're on the western side of the county, let's say, but we are not as densely populated as the eastern side, like Brewster, and Brewster is having a lot of challenges, and of course Brewster is closer to Connecticut, and Connecticut certainly has been having challenges with infections. But when you look at the density of areas, there are infections in this area. So the County Department of Health does not believe if the entire county stays above the threshold, they think the entire county will be designated as either a yellow zone or orange or red. I also checked with our school attorneys up in Garrison, and it will be a county-wide designation. What they said is, it gets complicated because within one school district, you could have 3 different zip codes. And, that exists, throughout the state. And they think it would be really hard to pinpoint and just go by school district. There's no reason to believe they will. Now, the opposite is true, though. And I think what has confused people, let's drop down to Westchester, the area of Portchester had a higher infection than the rest of Westchester, and that was designated as a focus zone. So they did move into the yellow. They were required to test. They weren't able to test. The district had to close, or not close, but go remote. And therefore, Portchester is right now. It's in a different position from the rest of Westchester. I think within a few days, all of Westchester will enter yellow, and then shortly after that, orange. So I think, again, if there's a spike in one small area, then yes, maybe that area would be the only place with a designation of yellow, orange, red. But if the whole county goes up, I think we will be included with the rest of the county.
Thank you, Carl. Does anyone else have any questions or thoughts on the potential resolution for regarding testing? Part of what I will also say is that even if we are able to get the testing machine and all the tests provided by New York State, which I now understand they will pay for and hopefully distribute through the Putnam County Health Department, it is our resources in terms of our personnel time that will go towards testing our staff and students, depending on our zone. James, you were unmuted there for a second. Anyone thoughts? Jocelyn?
I know that this resolution is kind of a boilerplate one that many districts are kind of signing on to, right? So I think so much is changing. There's a lot of whereases in this resolution, but I mean, I do think that the be it resolved section makes complete sense. It's very broad, and districts want the resources that they would need in order to conduct testing. So I don't see a problem personally with resolving this in a sense, because it is kind of a statewide advocacy effort to just try to ensure appropriate resources.
I agree. And my understanding is we can also rework the language as needed if we want to customize it further.
I mean, we could get rid of some of the whereases if we really cared that much, so it wasn't on record forever, as us saying something about our county Department of Health for rapid testing. But the point is, I mean, I do want to be an advocate, a voice for better allocated resources for districts.
Thanks. Matt?
I agree with that. I think it's great to put pressure on. To the degree that folks can also just keep this in mind for the next thing, there's obviously been an enormity of challenges with testing at the state level and at the national level over the last 10 months. It seems like there may be some movement now. That would be great for us and great for everybody. But the next challenge in 2021, in terms of state provision and distribution, is going to be the vaccine challenge. And so whatever lessons we can learn from this 2020 testing challenges, if we can sort of store them in our brains to help the state and help communication on whatever the state's going to need to do next year, in terms of that next sort of supply line challenge that I think is clearly coming and will be just as important, if not even more important, So that's not part of this resolution. I definitely support this resolution. I just think like I'd like to sort of plant that seed now so that we can all be thinking about ways to advocate for that, which seems like it's going to be around the corner, knock on wood, after the new year.
Thanks, Matt. I think that's a great point. And I think, we're good. It's clear we've been dealing with, I hate the word now, unprecedented challenges since March. And it needs to be a partnership between the district, the county, and the state. Working together, whether it's for funding and how this happens so that we can really focus on providing a safe environment, but also the best education at the same time. You can look at this meeting, we've talked about how to conduct COVID tests more than anything else, and we're a school. That's what we do, is we teach. So I do have concerns there that we need the support from outside to make it possible for us to do what we're supposed to be doing for the children in our district. Any other thoughts?
Sarah, I would just add one more thing from the perspective of my superintendent colleagues. We know there's a very significant wealth disparity, across our region, and I know this was worked on collaboratively with school boards as well as our superintendent's group. And one concern is that the wealthier districts could pay for testing. We even discussed earlier, could parents go ahead and get their test and submit it to the school? And the answer is yes. In the state guidance, that is a possibility. There is a concern that if the state doesn't provide tests to everyone and do it in an equitable way, that what you could potentially see is the wealthier districts paying for their test, being able to open or get more days in school, and those communities that could not afford to pay for tests because they are expensive. And I think, as you know, unless you're sick, your insurance doesn't cover it. If you're trying to test proactively, that's an out-of-pocket expense. So that was another rationale behind proposing this, and for equity across the region, across the state.
Thank you, Carl. I think that's a good perspective as well. Do we have any other thoughts or comments from the board? Dusty, if we wish to, I'm going to ask a procedural question now. If the board does wish to look at passing this resolution, what would be the process that we need to undertake at this time?
You could make amendments to this resolution now at the board table. And then if you decided to strike certain paragraphs or certain lines, you certainly have the option to do that. And then you could adopt it as amended, or you could put it off to another meeting if you wanted to have time to review it more.
Matt, I see your hand up.
Just had a quick question. Does anyone have any clarity as to why this isn't happening? I mean, I'm all for sort of applying pressure to the state, but it seems like a no-brainer. So I'm just curious if they explain, is it a lack of will or a lack of funding? What is actually the obstacle? I'm happy if all these districts can apply pressure from the bottom up to increase testing access, but I'm just curious why that pressure is actually required. Happy to give it, but it seems like an obvious thing that the state should be doing this for the schools, and I'm curious why it's not happening. Is it just that difficult? Fair enough. Is it a logistical thing, budgetary? What exactly is the holdup at this point? Do we know? Do we not know?
Carl, do you?
Matt, I really don't know the answer to that. Testing, if you've been following, which I know all of you have, testing's been an issue from the beginning. And a lot of people would say, from the federal government, that's where, scaling up to have mass testing, should have occurred a long time ago. So I think we're playing catch up. And that is my understanding of it. I know New York has taken steps to go ahead and contract with private industry to get these tests. So we're hopeful, but I will tell you, the concern is that, there's some criticism because right now as we speak,
I think Carl's freezing a little bit. Is anyone else seeing that?
Yes.
Okay, Carl, you're freezing up a little
Portchester
bit.
has been closed. Spoke to the superintendent, who I know, and he does not have testing. I'm sorry. So I don't know if that was clear, but again, what we're seeing is we're being told that the testing is available, but we are not seeing the evidence yet. But I do hope we start to see these tests rolled out within the next week or two. But I think that's what prompted school boards and the Lower Hudson Council of School Superintendents. I think that's what prompted them to promote this, to keep that pressure on, to make sure those tests are distributed.
Great, thank you. That makes a ton of sense. Thank you.
Okay, so that we don't spend too much time at this point, would we like to, if we don't feel, I know what is happening with testing is constantly evolving. Would we like to take this outside of this meeting and perhaps review the language and then bring it back at the next meeting and see where we're at with testing within the community, and if there's a need, and perhaps add some more language about equity, if that is a driving factor as well and important to our district? Is that something we can do, Dusty?
You can.
Courtney?
Like it makes sense.
Okay. Well, then I think we've had a discussion, we've looked at it. If you have suggestions on changes in the language, we will address that, take a look at it, and then see where the state is with testing. Is everyone all right with that? Just looking, I'm scanning everybody at this point. Okay. Thank you all for considering it, and we will now move on to accepting the minutes. It's a little different from testing. Okay, I'm going to read the recommended action. Be it resolved that the Board of Education of the Garrison Union Free School District hereby accept the minutes of the regular meeting of November 4th, 2020, and the minutes of the special meeting of November 11th, 2020. May I have a motion, please?
Moved.
Thank you.
Seconded.
Dusty, would you call the roll, please?
Jocelyn Appicello,
Aye.
David Gelber,
Aye.
James Hoke,
Aye.
Madeline Julian,
Aye.
Courtney McCarthy,
Aye.
Matthew Spicer,
Aye.
Tara Tormey.
Thank you. Now move on to financial reports. First up, we have the acceptance of the treasurer's report for September 2020. I'm going to read the recommended action first. Be it resolved that the Board of Education of the Garrison Union Free School District hereby accepts the treasurer's report, for September 2020 as presented. May I have a motion, please?
So moved.
Second.
Thank you.
Second.
Any questions on the treasurer's report? I do believe we have Sue in the audience if anyone has any questions. Or Carl, do you want to bring Sue in to provide some guidance on the treasurer's report?
Yeah, there's a couple of large numbers, obviously. So as Sue comes in, just any of her explanation for some of the transfers, et cetera.
Good evening, Sue. Thanks for joining us.
Hi, good evening, everybody. How are you? Yep, you're right, Jocelyn. There's a few large transfers, so I'll just go through it very quickly. On the multi-fund account, right? That's what I'm looking at. Yep, the multi-fund account. We started out the month with $845,566.64. Most of the money that we got in was taxes. That was just below 5 million, 4.8 million. And then there's federal and state aid of about 18,000. We had disbursements, and most of that was a transfer. 1.5 million was a transfer to the investments, because we do get a little bit more interest in the investment accounts, and you'll see that on the other page, of 2,772,744.20. So we ended the month at 2,966,324.71. And then on the investments, we started out with 4,709,861, and you can see in the interfund transfers that 1.5 million coming in there, ending the month with 6,210,037.57. So that's basically the big numbers, is the taxes coming in, moving money. Then in October, I did move some more money into the investments, because we do get a little bit better interest rates on the investment accounts than we do in the multi-fund account. Any other
Thank you, Sue.
questions?
Questions?
Okay.
I think we lost Carl. Dusty, you're a co-host now too, so.
Yes.
Okay. Any other questions for Sue? Okay. Thank you, Sue. Appreciate it.
Thank you.
I might keep you here just for the claim until we get to the claims auditor, just in case, and we'll go ahead, and if there's no other questions, do a roll call vote, please, Dusty.
Jocelyn Apicello.
Aye, and if you want James, I think he might be back in the audience if you want him for the vote.
Oh, there's Carl. Okay. Let's see.
I'm promoting James right now. I think he should be coming in.
Thank you.
Yeah.
Okay.
All right, we got everybody?
David.
Let's roll call.
David Gilbert.
Aye.
James Hogue.
Aye.
Madeline Julian.
Aye.
Courtney McCarthy.
Aye.
Matthew Spicer.
Aye.
Sarah Tormey.
Thank you. And then moving on to acceptance of claims audit report, October 2020. I'm going to read the recommended action. Be it resolved that the Board of Education of the Garrison Union Free School District hereby accepts the claims audit report for October 2020 as presented. May I have a motion, please?
So moved.
Thank you.
Second.
Thank you. Do we have any questions on the claims audit report? I don't see any. Okay, Sue, thank you for joining us. I appreciate your time this evening. We can go ahead and move Sue back and do a roll call vote.
Jocelyn Apicello.
Aye.
David Gilbert.
Aye.
James Hogue.
Aye.
Madeline Julian.
Aye.
Courtney McCarthy.
Aye.
Matthew Spicer.
Aye.
Sarah Tormey.
Aye. I'm going to go ahead and thank you. Okay. I don't actually know how to move people. All right, moving on. We're going to go to personnel items. The consent agenda. Read the recommended action. Be it resolved that the Board of Education of the Garrison Union Free School District hereby approves the personnel consent agenda for items 10B through D as presented. May I have a motion, please?
So moved.
Second.
Thank you. Do we have any questions regarding the consent agenda? Carl, is there anything you would like to add?
No, I will just say I wish Khadijah Howell well. She did obtain a permanent position in a business office, and that was her career goal. So it was a pleasure working with her. It was a short time, but we wish her well, and we will certainly pursue filling this as soon as possible to make sure we have the claims auditing process moving along efficiently. Also, we just appreciate Kathy Clark stepping up. We had a vacancy with our records management clerk needs. So Kathy has been with the district and does great work and is dedicated, and we're happy that she's willing to take on the responsibility.
Jocelyn?
And I see we're appointing a substitute. And so just on that subject, is this such great news because it's so hard to find substitutes, or I mean, how has it been trying to do that?
Yes, well, we have a connection here because Mia Emig is our new principal's daughter. And it has been incredibly challenging to find substitutes. She is a sophomore at Boston College, pursuing a degree in psychology. And under COVID, even if you do not have your teaching degree, you are able to substitute for 90 days for a teacher, longer for teaching assistants or aides. So she's done some volunteering, and I have to say I'm quite impressed with Mia. So you know, if we're able to get back up and running, which is the hope that we all have, I think Mia would be valuable in helping us at that point.
Thank you, Carl. Any other questions? Okay, I'm going to move to a roll call vote on the consent. Oh, Jocelyn, sorry.
I'm ready for the roll call.
Got it. Okay.
Jocelyn Epicello,
Aye.
David Gilbert,
Aye.
James Hoke,
Aye.
Madeline Julian,
Aye.
Courtney McCarthy,
Aye.
Matthew Spicer,
Aye.
Sarah Tormey.
Aye. Thank you. Moving on to new business, the CSE CPSE recommendations. First up, be it resolved that the Board of Education of the Garrison Union Free School District approve the Committee on Special Education CSE and the Committee on Preschool Special Education CPSE recommendations and student placements 17194, 17297, and 17357. May I have a motion, please?
So moved.
Second.
Thank you. Move to a roll call vote, please.
Jocelyn Epicello,
Aye.
David Gilbert,
Aye.
James Hoke,
Aye.
Madeline Julian,
Aye.
Courtney McCarthy,
Aye.
Matthew Spicer,
Aye.
Sarah Tormey.
Aye. Okay. Next is request for approval to appoint the internal auditor. Read the recommended action. Be it resolved that the Board of Education of the Garrison Union Free School District hereby appoints Raymond Pruser CPA PC as our internal auditor for the 2020-2021 school year in response to the RFP for auditors contingent upon the parties entering into a mutually agreeable contract for services and fees. May I have a motion, please?
So moved.
Seconded.
Thank you. I'm going to just go ahead and give a little background, and my other members of the audit committee, Jocelyn and Matt, feel free if you wish to jump in here. But in terms of the audit committee, we put out the RFP under Sue's guidance. I wish to thank Sue for helping us through this process. I also wish to thank our community member, Jesse Lunenpack, who serves on the audit committee, for volunteering his time for this. We reviewed all the RFPs, and we found this one would meet our needs. Does anyone have any questions? Madeline.
Can you remind us of the timeline for the internal audit to start, and when would we see the report?
Yes. Okay. So for the internal audit, and this is my basic overview, please keep in mind that the situation with COVID is continuing to evolve, but we hope to start the internal audit as soon as we're able to approve them as our internal auditors and come to agreeable terms, which I think will be very soon. So they first would do a risk assessment, looking at all different areas, everything. This is wide scope. And then they would rate those areas based on risk and bring it back to a report either to the full board or to the audit committee, saying they would like to do like what they call a deep dive. Excuse me for, I'm not as well versed as perhaps some financial people are in auditing, but I'm learning. into a specific area. Now, how long that process will take, I expect, I hope they can start work, in the coming weeks. I believe our new treasurer will be helping them with this process. My goal was to have them start before Sue's retirement, as she has so much knowledge. But I do think it'll go till about June 30th. So it's going to take months to get the report, review it, look at certain areas. And a lot of that depends on how much access they need to the actual school and whether we are able to give them access to the building itself. Carl, I don't know if you had anything you want to add to that.
Sarah, I think you gave a great summary. I also think depending on what area they focus on, they may be able to do some more work remotely, or it may require them to physically be in the building, going through records and files. So COVID could present a bit of an obstacle and slow us down, but as soon as they're approved, if the board wishes to move forward, we can get started right away. I'll just add that our new treasurer, Genevieve, has an extensive background. Of course, she's coming to us from the state comptroller's office. She not only performed audits, but supervised audits from municipalities as well as many school districts over the past 8 years. So I think she'll be a huge asset with this process as it unfolds.
Thank you, Carl. I hope that answered your question, Madeline. And I'm happy to talk more about our process too, if you have any other questions. Anyone else? Okay, I'm going to go ahead and move this to a roll call vote then. Dusty?
Jocelyn Apicello,
Aye.
David Gelber,
Aye.
James Hoke,
Aye.
Madeline Julian,
Aye.
Courtney McCarthy,
Aye.
Matthew Spicer,
Aye.
Sarah Tormey.
Thank you. Okay, we're going to move on to the request for approval of agreement for nursing services. Be it resolved that the Board of Education of the Garrison Union Free School District hereby approves the contract for nursing services with AccuCare Nursing and Home Care as per the agreement dated November 18th, 2020, and hereby authorizes the superintendent to execute said agreement. May I have a motion, please?
So moved.
Seconded.
Thank you. Okay. Go ahead and move to a roll call vote on this, please.
Jocelyn Apicello,
Aye.
David Gelber,
Aye.
James Hoke,
Aye.
Madeline Julian,
Aye.
Courtney McCarthy,
Aye.
Matthew Spicer,
Aye.
Sarah Tormey.
Okay, next is a request for approval of agreement for special education services. Be it resolved that the Board of Education of the Garrison Union Free School District hereby approves the contract for special education services with the Devereaux Foundation as per the agreement dated November 18th, 2020, and hereby authorizes the board president to execute said agreement. May I have a motion, please?
So moved.
Seconded.
Go ahead and move. Yes, James?
I have a question. Can Devereaux, what's Devereaux's supplying, and is it for one particular student, a group of students? What's the relation, the contract and relationship? What's the basis of it?
Sure, James, I to protect confidentiality of our student, it is one student.
Okay.
I don't want to get into too much detail about the program. I could certainly provide it, but this is a state-approved private program for children with disability, and it is a program that we don't offer in our school district. So it was decided by the Committee on Special Education that this was the appropriate placement for one of our students to attend.
It's a pretty highly recommended program, if I'm right, right?
Yes.
Is the program going to be in school, or is it going to be in a home, or is it going to be at their facility?
This is an in-school program. It is located in Westchester County. So like everyone else, they're hoping to stay open, but of course it may not. But if they do go remote, Devereaux would certainly provide a full remote program until they're able to be open again.
Okay. Thanks.
Thank you. Okay, I'm going to move to a roll call vote.
Jocelyn Epicello,
Aye.
David Gilbert,
Aye.
James Hoke,
Aye.
Madeline Julian,
Aye.
Courtney McCarthy,
Aye.
Matthew Spicer,
Aye.
Sarah Torme.
Aye. Thank you. Okay, we have now reached the public comment section. As I see, we have members of the public here. If you wish to ask a question or make a comment, please do so in the chat and I will read it. Again, as I reminded everyone in the beginning of the meeting, please, we would like to follow our policy. And if you wish to add a comment, please do not identify specific personnel or individual students. And okay, we'll leave some time here for people to add their comments in the chat. I guess I could have read that entire paragraph about our policy while I'm waiting to see if we have any comments in the chat. Okay, and I will remind everyone in attendance this evening that if you do not wish to make a comment or you still have a question after the end of the meeting, to please reach out to the appropriate individual at the school, whether it be an administrator, your classroom teacher, for an answer. Okay, I don't see any comments in the chat or Q&A, so I'm going to go ahead and move on to board member comment and other discussion. I believe last time we started at the top of the list. So I think we'll just go down one every time, maybe. Let's try and keep track of this all. So let's start with David.
No comments tonight.
Thank you, David. James.
Just a comment is, we're living through difficult circumstances here with trying to make what's the best decision for everyone involved. And a lot of this is beyond our control. So, I understand everyone's desire to keep the school open. I understand everyone's desire to perhaps close the school. Ultimately, it's just a hard decision. I just want to support Carl and the administration as they go about making these decisions. It's very difficult to figure out exactly what the right thing to do is in any given circumstance. And it doesn't help that we have vague guidance or guidance that changes, monthly, weekly, daily, when it comes to what we're supposed to follow and when we're supposed to follow it. So I think it's a tremendously difficult situation that the government, the state, and the federal government has put us in. So it'd be whatever we can do to localize our power and focus that on bringing about the best experience we can, whether it be in the building or remote, and how we go about making decisions. I just wanted to say that I think whatever role the board can serve in supporting and processing and facilitating good decisions, I think I speak for everyone when I say, we're here to do that. So that's it. I'm glad that the school has remained open. At the same time, I understand there are pressures from staffing, from parents, from your own conscience, as well as the state mandates to make decisions. So I am here to support what the best path is forward.
Thank you, James. I'm going to go to Madeline next.
No comment.
Thank you, Madeline. Courtney?
Just to say a quick thank you to the administration and staff and teachers for pivoting so quickly and reacting so quickly last week to getting everything in place and everything that needs to be done. It's an impressive about face from going from in person to virtual, and everyone's worked so hard to make that happen. So thank you to everyone who has put in time on that.
Thank you, Courtney. I'm going to go to Matthew.
I would just second all of that. Thank you.
Thank you, Matt. I have no further comment this evening. I am going to go to Jocelyn, and then I'm going to come back to David.
I just wanted to thank especially Nurse Melissa. I didn't want to thank her when she was on the panel because I didn't want to embarrass her, but she really is, like you said, Carl, so amazing and really level-headed and knows so much. So I'm really grateful she's here with us.
Thank you, Jocelyn. David?
This is really a question for Carl. Yeah, this has been a time of such incredible stress for adults anyway, between COVID and what's happening national scene. And Carl, I just wonder whether you're picking up anything in terms of elevated stress levels among the kids.
David, our counselors, I think would be better equipped to answer that. I know they've been very close to our students. And I will say with the in-person experience, I think our students have done really well. I'm not saying there hasn't been added stress, but I think in person, I will say I was happy to see on Tuesday afternoon at the very end of the day, the teachers just got them outdoors and allowed them to interact socially, which was great to see. We kind of put the academics aside for an hour and gave them that opportunity. So it was lovely to see, and it was also difficult because we don't know exactly when we'll get back. We're hopeful. The other thing, David, and for the rest of the board, please know that our guidance counselor Krista DiDiego, our psychologist Jessica Van Decker, Allison Emig, as well as our PTA, we've spoken to Ned Roush, and we're looking to partner to have a parent information night to really talk to parents about supporting children's emotional health, their psychological health. And I think that'll be a good evening. We're shooting for early December. We're going to try to get that together rather quickly. We'll have an expert panel. And I think that's something that should be ongoing, but we'll kick off the first one in early December so we can partner with parents on supporting the children.
Thanks, Carl.
Thank you, Carl. And David, do I have further comment from the board? I do believe, Destiny, correct me, but we have closed public comment. However, I do have a comment that has appeared here.
I see that.
May I read that comment?
Sure.
Okay. This is from the head of our PTA. And, he says, if he's not too late, open communication from the administration to families has been and will continue to be essential. In short, please keep on keeping parents in the loop. Also, thanks to all the staff and faculty for making such a smooth transition from in-class to remote learning. Well done. Thank you, and thank you to the PTA for all you have been doing while we were in person, and hopefully we'll continue while we're remote. We greatly appreciate your efforts on behalf of the school as well. Do I have any further comment from the board? Questions? Okay, I'm going to go ahead and we do not have an need to enter executive session this evening, if I'm correct on that, Carl? Okay, then I'm going to bypass executive session and go to adjournment. Be resolved that the Board of Education of the Garrison Union Free School District hereby adjourns the regular meeting of November 18th, 2020. May I have a motion, please?
So moved.
Second.
Thank you. We have a roll call vote.
Jocelyn Apicello,
Aye.
David Gelber,
Aye.
James Hoke,
Aye.
Madeline Julian,
Aye.
Courtney McCarthy,
Aye.
Matthew Spicer,
Aye.
Sarah Tormey.
Aye. Thank you, everyone. Thank you, Dusty. Thank you, Carl. Thank you, board, for your attendance this evening. And thank you to all the members of the public who came. That's it for tonight. I hope everyone wears a mask, washes your hands, stays safe, so we can see you all again soon. All right. Have a good evening, guys.
Good night.